Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center reporting for the week of August 2nd, 2021. We are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. After a brief update on what's going on here in Alameda County and Oakland in particular, I will try to help make sense of the CDC's new mask guidance, the data that seemingly motivated it, and what to do about it. We now have a total of 97,121 COVID cases in Alameda County, and this is an increase of more than 2,300 cases since I reported last week. There have also, unfortunately, been an increase of 14 deaths since I reported last week. We are now at a total of 1,286 people in Alameda County who have lost their lives to COVID-19. On the vaccination front, we continue to inch up. We've increased by about 1 percentage point, with now 84.8% of those who are eligible having received at least one dose, and 71.8% being fully vaccinated. Keeping in mind that we still have a really wide range of where people are vaccinated. We have census tracts that are as low as the 30% being vaccinated and others as high as the 90s. In Oakland, we're just a little below the county average at 82% with one dose and 68.5% being fully vaccinated. In Alameda County, we are continuing to see this troubling trend of increasing cases. You can see here the 14-day cases. This surpasses the peak that we experienced last summer. So if you can think back to last year at this time and how concerning our summer surge was, we have surpassed it, and we don't know when we are going to peak and start coming back down, but that has not happened yet. We continue this trajectory of going on this upward slope, and not sure when we will reverse that trend. Now, as you can see here in Alameda County, this is new cases by race. I reported on this last week as well, that at some point in April, the group with the highest number of new cases became African Americans, and that was for the first time in the entire pandemic. And as you can see here, this is the yellow line. This trend continues, and African American new cases are outpacing all the other groups. As you can see here, hospitalizations are continuing to increase as well. We now have 179 people with COVID-19 in our hospitals. That is an increase of 45 people since I reported last week. And as you can see here, this troubling trend is continuing. Also, as a reminder, we are now dealing with a much more contagious strain of COVID-19, the Delta variant, which looks to be about twice as contagious as the main strain that we've been dealing with here in the United States for the majority of the pandemic. Delta has now essentially taken over, and this is the new pandemic situation that we are now dealing with, and is part of what has spurred the CDC's new mask guidance. So over the weekend, the CDC released new mask guidance, which essentially reversed their earlier relaxation of the mask guidelines in mid-May, where they had said that anyone who was vaccinated could stop wearing a mask in public. And this relied on the honor system. So a number of us had a question about how effective this would be, or how well people who were not vaccinated might adhere to this, and we probably don't really know the answer to this, but we certainly see that cases are going in the wrong direction, and the CDC reevaluated those guidelines based on, I'm sure, a number of factors, but the one that they cited was a recent case study which was published by the CDC in their Morbidity and Mortality Weekly Report, the MMWR. You can find this on the CDC's website. And this article here is a review of an outbreak of SARS-CoV-2 infections, including breakthrough infections in Massachusetts. And it doesn't call it out here, but of course we've seen in the media that this was in Provincetown, where between July 3rd and July 17th, they held multiple summer events and large gatherings, and where a number of people, an estimated actually 60,000 visitors, uh, came to the area for July weekend, July 4th weekend alone, packed into the town, and were sort of having a good old time, like it was 2019, like it was before COVID, and in part possibly believing the prior CDC guidance that masks were not necessary if they were vaccinated. Now, Provincetown, their city manager estimates that 95% of their permanent residents are vaccinated, so that's incredibly high. They are definitely known to have high vaccination rates. And so this was sort of the kicking off of their summer, and they were having events within bars and restaurants and guest homes and so forth. And so they had an outbreak, and they have now traced 965 cases back to these gatherings. During their contact tracing process, they received multiple reports of people attending densely packed indoor events. And the report in the MMWR is reporting on a subset of these 965 cases. They are reporting on 469 of these cases, and 346 of those people were vaccinated. So the headlines that kind of took off over the weekend were saying things like 74% of cases were among vaccinated people. And this is, a misleading kind of a headline, because it does not take into consideration how many people total there were and what their vaccination status was. And this really highlights the challenge that we're having in being able to communicate during this evolving situation. And so, really, the way we probably need to be talking about this is, what is the case rate among vaccinated people and what was the case rate among unvaccinated people? But since we don't know that, we don't have the denominator, we can't do that. And so, as we have more and more vaccinated people, the fact is that we're going to have more vaccinated people who catch COVID and who are in the hospital and even who die. So, even though it is a tiny percentage, because more and more people are vaccinated, that number and that percentage will go up. So, this is kind of basic math, but it's a little bit hard to wrap our heads around, and it makes it even harder when the media takes these things and runs, because there's no context. If it's true that you have a population that's 95% vaccinated, then no matter how many cases you get, there's going to be a percentage of them that are vaccinated. Again, it's kind of simple math, but it starts to get complicated when you're trying to assess a single outbreak and you don't have the denominator of everyone who's involved. So really, the only real conclusion you can draw about the vaccine's effectiveness from this single outbreak is that it's not 100%. That's because, again, we don't know the denominators. We don't know how many attendees were vaccinated overall. So we cannot compare the vaccinated to the unvaccinated in this setting. There's also a lot of other factors we just don't know about. But what was concerning about it was that it led to the concern that vaccinated people were transmitting COVID-19. Now, remember, we've really not ever said that vaccinated people could not transmit COVID-19. In fact, I think what we've been repeating is that we don't really know. We think the chances are much lower. That is what we have thought up until now. But the CDC's announcement made it seem like they were concerned that they feel differently now because of the Delta strain. And I'm going to get to that piece in just a moment. But first, let's finish talking about the particular outbreak in which we had 469 cases. In Provincetown, 5 of those were hospitalized and none died. Now, of the 5 hospitalized, 4 were vaccinated. Again, very impossible to draw any conclusions about vaccine effectiveness against hospitalization from this, except that it's less than 100%. Because, again, we don't know the total vaccinated population. And we also don't know much about the age or condition breakdown or other factors that might kind of mix up the picture a little bit. So, for example, we know that the older age groups are at higher risk of perhaps getting a breakthrough infection in the first place because they may not mount as strong of an antibody response, but they're also the most likely to be vaccinated. So, again, we're missing some denominators, we're missing a lot of factors to really draw conclusions about the effectiveness of vaccines against Delta. And so this trying to use an outbreak like this to do that is just simply not logical. And so I hope that we can sort of get to a better place in terms of how we talk about outbreaks and also how we talk about assessing vaccine effectiveness against new strains, because this may unfortunately not be the last strain that we have to deal with at the rate that we're going here. So, but I will say this, roughly, if we had, let's say, got an outbreak of 469 people, let's say none of them were vaccinated, then if we look at sort of the averages of what we were seeing pre-vaccine in terms of hospitalization rates and death rates, then out of the 469, we would have expected at least 25 people to end up in the hospital and about 8 people to die. And instead, we had 5 people go to the hospital and none die. And we know that, again, the 74% of them had been vaccinated. So really, the conclusion that I draw here is that the vaccines did the job of making the outbreak not fatal and of reducing the number of people who went to the hospital. The reports that we've been seeing is that those who did go to the hospital did have some underlying conditions. Don't know a lot of details about what those are, but that is pretty consistent with what we are seeing across the country, where those breakthrough cases that do end in hospitalization or death are a very, very small fraction, and that they are among people who do have underlying conditions. And it does look like there are going to be some guidelines coming forward, particularly about people who are immunocompromised as to whether they need a 3rd dose or not. And so we're waiting to hear about that, but particularly we're concerned about people who have had organ transplants, people with cancer, people who are on immunosuppressing medications, that they may indeed need a 3rd dose. And again, they are reviewing that data now, and I think that there will be some recommendations that are forthcoming. And so, what about reinstituting the CDC mask guidance? So you know my opinion from prior briefings, if you've watched them, that I believe that the CDC dropped the mask guidance too soon. Mini rant here is that the mask guidance was dropped in mid-May. And in mid-May, actually 3 days before the CDC dropped the mask guidance, the World Health Organization declared Delta variant a variant of concern. The CDC knew about the Delta variant, knew the World Health Organization thought it was a variant of concern. It didn't meet the criteria for a variant of concern here in this country. I won't pretend to know all the ins and outs of how that was determined, but the CDC declared the Delta variant a variant of concern a full month later. And so you could ask whether the dropping of the mask guidance facilitated the spread of Delta. We probably will never know that. But at the same time, I think what I hope for as we move forward is that there is a quicker responsiveness, and that we think about really tracking these things a little more carefully. So the couple of things that I think are weak spots in our current pandemic monitoring and response is that, first off, the CDC stopped tracking breakthrough cases unless they ended in hospitalization or death. So that means that we're going to have a little bit of a blind spot overall as to how many breakthrough cases we're having. Now, fortunately, some states, some counties are doing this themselves, and so we will continue to get more data in. But that is nothing compared to having it be a national effort that is all feeding into one data source so that we can really get a comprehensive understanding. So I'm hopeful that the CDC is going to reverse their decision on that. The other challenge that we've been having is that we're still only sequencing a very, very small percentage of our positive specimens. And that leads us to getting blindsided, unfortunately. And I can't help but think that if we had declared Delta a variant of concern sooner, then what that means when it's declared a variant of concern is that everyone is required to report on it. And so perhaps we would have seen this coming. Maybe we would have not dropped the mask mandates in the first place, and then we wouldn't be in the situation of having to then unring the bell, which we know is very difficult to do. So, fortunately, here in the Bay Area, I think there's been great respect for um, wanting to mask in public, understanding that there are people who are still vulnerable. And I do see a number of people continuing to wear masks. But I also see that there are a lot of gatherings where people are not masking. And I'm hoping that this will be a bit of a wake up call to say, okay, I think we tried to go back to normal a little too quickly, and that we need to continue to exercise caution. So, bottom line of the outbreak is that the outbreak is over in Provincetown. Nobody died. Their way of life is heading back to normal. Their case rates are coming back down. It certainly is never ideal. All outbreaks are frightening, and again, something that we can probably avoid if we can not have mass gatherings without masks on. But I think it is just underscoring what we already know, that the vaccine is not a bulletproof vest. It is a huge protector, but we still need layers of protection, like we talk about every single week on this briefing. We still need our layers of protection. Vaccine is the most effective one by far. It's also the only one that gets us out of the pandemic. So, the other thing that's concerning about a lot of the chatter that I see and some of the reports that I read is that it's creating kind of a false sense that, oh, you could either get the vaccine or you could wear a mask. Those two things aren't the same. So, the best protection that we get is by layering protection. So, that includes vaccination, masking, distancing, avoiding crowded indoor spaces, making sure that we have good ventilation. All of those things together are important. And these are going to be important until we get to a threshold where we're not where this virus isn't spreading to the extent that it is now. But right now we're still in a pretty concerning situation, and we are seeing that we still are not sequencing very many specimens. But I'm just going to say that the Lambda variant has been declared a variant of interest by the World Health Organization. It hasn't been declared anything by the CDC yet. It is certainly spreading across South America, and we have over 700 cases in the United States. But again, the United States is only sequencing about 1% of specimens. The state of California is doing a lot better, maybe sequencing something like 7 or 8% the last time I looked. And we have 144 cases of the Lambda variant here. And there is some evidence that the Lambda variant may evade our vaccines. So this is pretty concerning. We definitely need a lot more data. And this isn't really meant to be frightening. It's meant to say, can we not repeat our mistakes? Can we please keep an eye on what is going on the world stage? We know that it doesn't take much to import a variant. We never know how these variants are going to compete against each other. And so we don't know if the Lambda, for example, is going to outcompete the Delta or not. We just don't know. So as these things are unfolding, I think it's really important that we keep alert, and then we keep doing all the surveillance that is possible, and then we don't wait until something is a problem before we then react, which is a bit what this mask guidance feels like. But it doesn't mean it isn't the right call at this point. Probably what I would have appreciated would have been, hey, we made a mistake. We dropped the mask mandates too soon. It's time to re-implement them. But, I like radical honesty. And I get it. But I certainly think that the communication is causing confusion. And what I think the real message from this outbreak should have been is that outbreaks can still happen. Uh, Forward transmission from vaccinated people. We never knew if it could happen or not, but we never had any reason to believe that it could not happen. And this is what I'm going to get to now. So, whether or not vaccinated people can spread it as much as other people, as much as unvaccinated people after they catch COVID-19, was the other reason that was cited for this new, for the resuming of the mask guidelines. And that was based on specimens taken from the nose of all of the people who tested positive, whether they were vaccinated or unvaccinated, and what they found was a very similar viral load in the nose. So they then took that to say that unvaccinated and vaccinated people were just as transmissible as one another. And I believe this is a bit of a stretch. I don't think that we know that. And in fact, I think that there is some evidence or information that would suggest otherwise. Now, it certainly, people who are vaccinated who catch COVID-19 need to follow all of the precautions because we do know that it can be spread. But to say that it can be spread at the same rate as unvaccinated people, we just don't have the data for that yet. And I'll give a little more context to this. So, for example, there are some studies, they are in the preprint state, but some studies that are suggesting that although at some point in time the amount of uh, viral load in the nose is the same in vaccinated among unvaccinated, that vaccinated people clear it much more quickly, so the duration of time may be much shorter than unvaccinated individuals. The other thing is that what's going on in the nose is not necessarily what's going on in the lungs, and what's going on in the lungs, the viral load in the lungs, is actually quite important here, and that was not determined. And last but definitely not least, one of the ways that transmission happens most efficiently is because of the symptoms. So if you are coughing, sneezing, etc., then we know that you are spraying particles at much higher force and rate, and that those droplets from the lungs, again, if there's a high viral load in the lungs, will be transmissible. And if you have no symptoms or have very mild symptoms, as is the case with the vast majority of vaccinated people, then you're not doing all that coughing and sneezing. And we don't know, again, if the viral load in the lungs is comparable or not. So, all of that to say that we need more information to talk about how transmissible vaccinated people are compared to unvaccinated people when they catch COVID-19. But what we do know is quite clear and quite compelling, and that is this. So I took this from the Washington Post, and it is basically a graphic representation of the data from the CDC taking us through July 24th, 2021. And there's so many different ways to look at this data. Some of them just don't make a lot of sense, but I thought this one was nice, simple, straightforward, and accurate. And there is just no comparison in terms of what is going on between vaccinated and unvaccinated. In terms of infection, 8.3 times more likely. But I think what is most compelling and most concerning is hospitalization and death. This is why the vaccines are important. These were actually really the only endpoint that the vaccine trials were looking at, and it is continuing to do its job. Those who are unvaccinated are 25.2 times more likely to go to the hospital and 24 times more likely to die with COVID 19. And this is through July 24th, so we know that this does not have the full brunt of what's going on with the Delta variant. It's not even sorting that out yet. But with Delta, I think what's most important to know is that it is far more contagious, which means that it will find you. If you are a susceptible host, it's like a heat seeking missile, it will seek and find you. And so I think that the calculation has changed in terms of how able you will be to avoid it by just wearing a mask or being careful. I think we all need to continue to do that. But I think it's clear that the vaccine is the best protection that we've got. It's not perfect, but it's kind of all we've got at this point. And it's the best protection that you can do for yourself and for the people around you, the people that you care about. And when you look at something like this about you, if you are unvaccinated, you are 24 times more likely to die if you catch COVID. That is pretty astounding. And I think is something that needs to be taken very seriously as we deal with this really rapidly spreading variant. And we don't know what's to come after this, but this is kind of the best chance we have is to continue to try to get more people protected. We've got about 93 million eligible people in the United States who are not yet vaccinated and may be waiting. And I think, probably don't want to wait anymore because a lot of people that are in the hospital right now with COVID are wishing they hadn't waited. And at this point, I'm just wondering what is it that we're waiting for because the evidence is very, very clear. And even though I do understand that this is all feeling really new, we've got about a year of data on the COVID-19 vaccines. That's I think for a lot of us, we like to see a year. So we've got a year now, and that is reassuring. And so, we're also seeing that when people do get the vaccine, it is a sense of relief that I think people underestimate until they've gotten it, and then they realize, wow, I can at least feel like I've done the best thing I could do for myself and my loved ones. And we know that it's not perfect, so we do want people to still continue to take all the precautions. But it is certainly the best thing we've got in our armamentarium. Now, I just want to touch on what I know I review probably every time, but the modes of transmission, because I still hear a lot of confusion about this. I hear, well, I'm going to be in the classroom all day, but we've got partitions. Partitions are for droplet transmission, to prevent droplet transmission. So partitions are good if you're going to be within 6 feet of somebody and it's going to be in between you so that the droplet doesn't go. But if you're in a room with someone with COVID-19 for a long period of time, then it's not just about droplet transmission, it is about aerosol transmission. And so really the question is, how good is the air exchange? How many air exchanges do you have? How good is your air filtration? I've also heard people say, well, I'm outside, so I don't need a mask. Well, if you're standing 2 feet away from somebody, and I see this all the time, you're standing 2 feet away from somebody, then the fact that you're outside, that's only preventing you from aerosol transmission. If someone sprays on your mouth, then you can get droplet transmission. So I really think, as annoying as it is, it's important for us to think about all three types of transmission: aerosol, droplet, and surface transmission, and which ones are we concerned about at when which points in time. So if you are going to be going inside somewhere and you're not going to touch a single thing, then you're not worried about surface transmission because you didn't touch a single thing. Someone hold the door open for you, you go inside, you don't touch a single thing, then you're not worried about surface transmission in that case. So I think it's important to think which kinds of transmission are you subject to in which environments, and then do the protective factors that you need to do for each type of transmission. I see a lot of questions are coming up because schools are going to be reopening, and a lot of confusion about people saying, well, it's good, they sanitize, every hour. Okay, but our main concern inside of a classroom setting where you have a high number of people in an enclosed space for a long period of time, your number one concern is going to be aerosol. So your mitigation factors are going to be ventilation and filtration. You still do have to worry about droplet and you still do have to worry about surface, but your main point of concern is going to be aerosol because, again, the air fills up over the course of the number of hours that you are inside. And we're going to be talking more about schools next week when hopefully there will be more information forthcoming. But I do want to say that some of the communications that we're seeing coming from the school about testing and vaccination and so forth are very polite and mild, and I want to perhaps underscore some of them here. If you have symptoms, you should not be going inside of an enclosed space with other people, especially unvaccinated people. You should be getting tested and you should be isolating until you get your results. If you've been exposed, same thing. And so I see, please consider getting tested. I think it should be absolutely prohibited from anybody with symptoms or exposure to be going inside of a school setting. That includes teachers, that includes parents, and that includes children. And so if the child is sniffling, they shouldn't be going into the classroom until that you have demonstrated that it is not COVID-19. I understand this is not an ideal situation, but this is the situation that we're in. And so, again, next week we'll be discussing more details about school, and hopefully we'll have more to share in terms of what it is that the schools are planning to do as it relates to distance learning options and capacity for that, as we are in a very different situation with Delta than we were before, and that needs to be taken into account. Thank you for joining. See you here next Tuesday at 10.